Hi, Betty. Welcome back. It's great to see you again. So, first things first is I have good news for you. You've done the right thing in coming to see us. After reviewing your x-rays and the series of exams we performed, I'm feeling very confident that what you have is treatable with chiropractic care. So the good news is you're in the right place at the right time. But now that we've established that what you have is a chiropractic issue, I want you to know a few things about it before we get started. As you may remember from the video we had you watch, chiropractic is not new, it is not experimental, and it's been a successful form of treatment for cases just like yours for over 100 years now. In fact, the results of chiropractic have become so popular and so successful, it is now the second largest healing practice in the Western world. And what's most important for you to know is that a study by WebMD following 2 million patients over a course of 4 years demonstrated a 95% satisfaction rating with chiropractic. 95%. Now let me tell you, in the medical world of healthcare, it's impossible to find a better success rate or series of results than this. So you can feel very confident that you've come to the right place to find the solution to your healthcare problems. Now, one more very important thing that you need to know about chiropractic is that it's natural. In today's day and age, it's becoming increasingly more important. Because let's face it, Betty, we're all becoming way too drug dependent. Your body's been made with this amazing capacity to heal itself that far exceeds past anything that man could create, like a drug. Your body is better than a drug, and we need to rely on it first. Have you ever thought about how your body heals itself from something as simple as like a cut to the finger? Well, it stops the bleeding, it repairs the tissue, and within a short amount of time you can barely tell an injury's occurred there in the first place. And it's able to do this through the control of a system which we call the central nervous system. Now this system knows better than you do what it needs to make the body healthy. And when we remove nerve interference, your body can better diagnose and heal itself properly. That's why it's so important that your first choice on your healthcare journey be one that's natural, before we resort to using harmful drugs with their harmful side effects and risk for addiction. It's not to say that drugs don't have their place, because of course they do, but they should be used more of as a last resort and not as a first. Now, let's talk about what brought you in here. Let's talk about your condition. Why do you feel the way that you feel, and why are you in the pain that you're in? Well, I'm here to tell you, your issue didn't begin yesterday, and it didn't begin the first moment that you started feeling pain either. Pain is usually one of the last indicators to the body that something's going wrong at all. Your issue has been building up over a long period of time, and is the accumulation of all the events in your life. Your issue, in fact, began with the traumas of childbirth. And anyone that's seen a child being born can attest to the traumas that occur to the head, neck, and spine, as we all are put through this process. And it doesn't stop there. Think about all the hundreds of falls, spills, and accidents you've had through your childhood and teenage years. You've really needed this care as you've been growing up. It's amazing to think that any of us live past the age of 5 with all the hits and injuries our bodies take over this time. You've needed this care as you've been growing up, and what has saved you from a lot of the wear and tear you're experiencing now. Now, the reason I'm telling you all this is because if you're planning on having kids, or if you have children already, they're probably going to live to be 100 years old. And we want them to be as mobile as possible throughout those 100 years. Does that make sense? Fantastic. Now, let's take some time to talk about the lifestyle you've been living up until this point. Betty, it's impossible to count the number of improper lifts and physical traumas that have occurred to the body. That's why we say it isn't just one event. You have wear and tear already. But keep in mind, this is with no prevention, no treatment, no care, and no effort whatsoever to offset any of these issues from occurring in the first place. That would be like if we never went to the dentist, or brushed our teeth. Nothing. From the moment you were born to where you are now. Think about what kind of condition your teeth would be in. It'd be amazing to think that you'd have any teeth left in your mouth at all. Am I right? The same thing's been going on with your body. You have a lot of nerve and tissue damage that has been accumulating over the years. So it's really fortunate that you're not in worse shape than you're in already. Now, it's taken some time to create this physical condition, so it's going to take some time to get out of. As another example, imagine we put on weight over a 10-year period in time. We'd all want it to be off in 10 days, right? But that's simply not how the body works. These issues take time to create, so they're going to take time to get out of. We'll talk more about the timing of your treatment here in just a moment. Right now, let's talk about where you are now. What are the results of this series of exams we performed and all this wear and tear that's been building up? Well, your spine has been pushed and pulled out of alignment, causing a decrease in flexibility, leading to irritation and pinching and swelling as the nerves flow out from in between the individual segments of the spine, which we call vertebrae. Now, the medical term for this pinching is called a subluxation. And if you look at this chart over here, you can see some of the things that occur with subluxations in different regions of the body. And I think you'll find this part fascinating, as it demonstrates why so much of your overall health is affected by these subluxations. The reason for this is because nerves travel from the brain to communicate commands to the whole body and all the organs that are there. This is how your body knows how to heal and function properly. Now, you came in here with low back pain, but if you look at this chart over here, you can see some of the things that are associated with subluxations in this region of the body. It can lead to pain in the groin, pain down the legs, and even possible abdominal issues. This may sound a lot like some of the issues you're having now, doesn't it? This is occurring because there's pinching on the nerves, and it has the exact same type of effect that we experience today with our cell phones. When there's interference in a call, what happens? The call drops, or the communication starts to break up. And what do? We move to the nearest location possible to try to get rid of this interference so that we can get the whole message across. The same thing's been going on with your body. Its ability to communicate with the brain has been cut off, and the result is pain and disease. That's why we say subluxations cause more than just neck and back pain. They can result in other forms of disease as well. And when we remove this nerve interference, your body's better able to function, and you may experience better areas in health, not just getting rid of that low back pain. That sounds pretty good, right? Great. So, I want to take some time now to discuss the degeneration process of the spine. As you can see here, there are 4 stages to the degeneration process. Just like many other diseases have stages, let's use cancer as an example, because it's something that we all know something about and we can easily understand. When cancer is let to progress through its various stages, what happens? Your overall symptoms and the severity of the disease become worse and worse, and it takes more time and more treatment to get you back to where you were before. That's why it's so essential that we begin your treatment now, so that we can prevent the stages of degeneration from progressing any further. Does that all make sense to you? Fantastic. Currently, I'd rate you at a stage 2 of the degeneration process. But let's take a look at your x-rays so you can understand a little bit more about what I'm talking about. So, since you can't take these x-rays home with you, I'm going to circle on this chart here the spot that most exemplifies where you're at right now. So you can take it home to your family and show your husband exactly what we've been talking about here today. Okay? Great. Now, we've talked enough about the cause of your issues. Let's talk about what you came here for. Let's talk about the solution. The solution here is going to be a series of adjustments that I'll perform to your spine in order to get it back in the proper alignment so that you can get your whole health and wellness back. Now, there are a few things going on to the body while I'm adjusting you that I want you to be aware of, since they aren't things that you can see. Number 1, I'm removing nerve interference so your body has 100% capacity to heal itself from any current pain, injuries, or illnesses that you may have. Number 2, I'm removing nerve interference so your body has 100% capacity to prevent any future disease or injuries from occurring in the first place, so you don't get so much sickness to begin with. And thirdly, I'm removing nerve interference for your body's future performance of its musculoskeletal system, so you don't get this wear and tear to build up, so that you can maintain mobility throughout your entire life. Does that all make sense? Great. So a moment ago, I said it's going to take a series of adjustments. Did you catch that? This is for the exact same reason that an orthodontist doesn't reach into your mouth and rearrange all of your teeth back into their proper position on the first try. They, like us, are going to tell you it's going to take a series of visits to get those teeth back into their proper alignment. And with enough time and enough treatment, they'll eventually get everything back into its proper position. The same thing's been going on here. When we treat you, we're going to be putting your spine back into its proper alignment so that you can get your whole health back. Now, the truth is that your spine has been misaligned for so long, it actually considers this misalignment to be normal. We're going to have to retrain it. And again, this is going to take some time. I'm going to adjust you back into the proper position. And frankly, your spine's going to readjust back to where it's used to being. Kind of like 2 steps forward and 3 steps back. But we'll continue to adjust you and put your spine back into its proper position so that you can get your whole wellness back. And again, this issue is going to take time. That's why it's so important that you don't miss any adjustments. Follow them down to a T. Don't miss any. It's the number of treatments and the timing of those treatments that make chiropractic so successful for you. Does that make sense? Fantastic. Now, I've broken your healing down into 3 stages. The first and most obvious stage is going to be the pain relief stage. We want to get you out of pain. Now, everyone responds a little bit differently to this stage, but for you, I'm suggesting that we see you 3 times a week for the next 4 weeks. We'll also be supplying some additional therapies along the way to help supplement these adjustments so that you can do better and just function better in your spine. I feel confident that at the end of this phase, you'll be feeling good and you'll be out of pain and you'll be thinking, great, I feel better. Problem solved, right? Well, I'm here to tell you that that's frankly not the case. Your spine in this case, and at this point in your condition, will be unstable and fragile. We need to get rid of this fragility. Any wrong lift, almost any turn and event, could set you back to where you are now, or possibly even make things worse, and we'd have to start all over again. That's why the second phase of your care is even more important than the first. The second phase is the stabilization phase of care. We want to stabilize your condition so that you're not in such a fragile state anymore. But before we do that, we'll do a short progress exam to make sure that you're ready for this second stage of care. And it's also at this time that I'll be cutting back any treatments that we may have provided. Because I'll be the first one to tell you that if we were doing a little bit more than we initially thought, let's drop it off. Now, assuming you're ready for the third phase of care, you'll graduate, and I'm sure things will be easier for you. I need you to continue to come in for your series of adjustments, but only 2 times a week for the following 3 weeks. And again, at the end of this point, we'll do a short progress exam to make sure that you're ready to move into our third phase of care. The third phase is the most important overall, because it's the wellness phase. Now let me tell you why this phase is so important to your overall health and wellness in your condition. Betty, you see, the one problem we have with conditions just like yours is that we're not actually getting rid of the cause of the subluxations in the first place. We don't expect you to stop your daily activities that cause this nerve interference on your musculoskeletal system. But the difference here is that we're going to provide a series of adjustments to counteract this wear and tear from building up, so that you don't get back to this debilitated state. Because just like your teeth, it would be amazing if you could just clean them one time and they'd be clean for the rest of your life. But that would mean that you never have to eat again, and we can't expect you to do that. Just like we don't expect you to stop doing the things that make you you. We don't expect you to stop living your life. The difference here is that we're going to provide treatment to counteract all these issues from occurring. Now, when we get to this wellness stage, we'll make the recommendations that we need for you at that time. So, our overall goal here is wellness, not just getting you out of pain. Natural wellness is what you need, and it's what we can provide. But for us to get you there, I'm going to need a few things from you. First, I need to make sure that you come into all of your scheduled appointments. It's the timing of these treatments and the frequency that make chiropractic work so well for you. Secondly, I need you to attend our special class. It's chock full of information that I'm sure you've never been taught before, and I know you'd really enjoy it and benefit from it for the rest of your life. I've included tickets for you, and we have times at Wednesday at 5 p.m. and Thursday at 9 a.m. Which one can I put you down for? Great. I'm going to put that down here. So, a moment ago I said I've included multiple tickets. The reason for this is because if you have any friends or family that wish to attend, we're more than happy to have them, because I'm sure that they can benefit from this as well. Now, the third thing is if you miss any appointments, we need you to make sure that you make them up. Because again, it's the timing and frequency of treatments that make chiropractic work so well. So, now that I've gotten all this, I'm going to sign here on this form indicating I've made all of my best recommendations. And I need you to sign here too, saying that you're going to make every effort to comply with these. Alright, now that we've taken care of this, I'm going to have Stephanie come in here. She's going to get you scheduled for all of your treatments, as well as get you scheduled for your How to Stay Young class. And she'll go over any financial questions that you may have. I'm going to go grab her and we'll be back soon. Now that they've gone over all this, do you have any further questions for me? No? Great. I'm glad to hear it. I'm ready to begin your treatment. Are you ready? Fantastic.